My name is Rashmi Halker Singh, and I'm the Headache Medicine Fellowship Program Director at Mayo Clinic in Scottsdale, Arizona. If you are a neurology resident and are interested in taking care of a diverse population of patients that lack access to expert care, be involved in cutting-edge research, join a field of medicine that is rapidly expanding with treatment options and is also filled with people who care about social determinants of health and how they impact disease, I invite you to consider a career in headache medicine. Additionally, I will also offer that Mayo Clinic in Arizona is one of the best places in the country to gain that foundational fellowship training where we place an emphasis on patient care, education, and research. At our program, we will equip you with an outstanding year where you will gain experience in both adult and pediatric headache medicine, as well as become proficient in procedures for headache conditions. You will have protected time for research and also have mentorship to hone your research skills. Our fellows not only publish in journals, but also have the opportunity to present their work at both national and international meetings. They also have opportunities to teach residents and medical students and also gain experience in advocacy. By the time they finish their fellowship, our fellows are well prepared for any career in headache medicine.
Clinically, our program is comprehensive, but also allows flexibility based on what you need. And some of the unique attributes that we have here in our program is we have a multidisciplinary concussion clinic, which is run by one of the headache medicine neurologists. We have a neuropsychologist as well as a vestibular audiologist. We're able to really provide that multidisciplinary care for post-traumatic headache and concussion. And this is unique within our program to have this type of setup. And a great skill for you to be able to leave a headache medicine fellowship with, given that individuals can leave the program and develop a comprehensive concussion clinic wherever they go next for their job.
One of the big strengths with our headache program is that we also have an autonomic program here, and we do autonomic testing, and we see a huge overlap between headache disorders as well as autonomic disorders, which can be really important when distinguishing between headache disorders that are postural in nature, that might be something like a spinal fluid leak, or an autonomic disorder.
Fellowship is such a unique and interesting time in one's medicine career. It's really a time when you get to focus on the learning of the subspecialty, and you don't have a lot of those extra administrative duties to get in the way, shall we say. And I think one of the key aspects when looking for a fellowship site is the people that are there. That really makes or breaks your experience in fellowship. And I always, when I was thinking of fellowship sites, there was three things that I kept in mind for this, and these were the 3 A's, and these were aptitude, affability, and availability. And one of the nice things about the Mayo Clinic here in Arizona is that they have all three of those aspects in the faculty that they have within the headache division.
And I wanted to just take a few seconds here to highlight some of the research opportunities that you would have here in our program. This would include involvement in clinical trials of migraine and post-traumatic headache, as well as other headache types. And then you would also have the ability to do research that would utilize existing data, such as data from the medical record system, from large headache databases that either we've populated over the years or that we have access to, as well as extensive data that we've collected in regards to brain structural and functional imaging. And so there's an advantage there in that you would already be able to come in, there would be existing data from which you could quickly and efficiently ask questions that are important to you. Furthermore, we're always open to individuals coming in and wanting to do prospective studies that could be feasibly completed within the time of your headache fellowship training.
So I actually really enjoy seeing the patients. I think you get to see a lot of broad topics of headache here at Mayo. You will see some very complex patients, so you will not leave here without having a lot of knowledge and experience of really managing the unusual headaches that are out there, and just really complicated patients with a lot of medical history that you have to take into account with all of your decision making. And so that's been my favorite. I do like the procedures too as well. You'll definitely get to have a wide breadth of different procedures that you'll train in, and you feel very comfortable after just a month or so of doing them with your attendings. And so I've gotten to do Botox, occipital nerve blocks, supraorbital nerve blocks, auriculotemporal. So you end up with a lot of experience at the end of it.
I'm very, very passionate about healthcare advocacy, which is important for every physician to participate in, but especially for us as headache medicine specialists because of how much stigma that is present in the disease of migraine. And so we definitely provide advocacy as a part of the curriculum within the fellowship and multiple opportunities to interact with patient advocacy organizations such as the American Migraine Foundation, Miles for Migraine, as well as participate in specific physician advocacy with the Alliance for Headache Disorders for Headache on the Hill every year, and any other mentorship that would be needed in that space, we're happy to do.
Arizona is also a wonderful place to live and train with so much to do. If this idea of a headache medicine fellowship year excites you, and you are interested in working with a group of attendings where we are all passionate about what we do, I encourage you to come interview with us. We look forward to your application.